And you probably know somebody or have dealt with a sick kid, know somebody who has a sick kid right now. I know both of our kids were sick last week.
You've been slept through our house, and I was like, knock on wood. I was like, we're so lucky. You were like, yeah, we got a little stomach thing here. And I'm like, no, we're fine. We're never fine.
And then it comes through. And with all this, we've been seeing an uptick in the amount of kids that are then obviously being taken to urgent cares and hospitals.
Yeah, exactly. So we reached out to Children's Hospital, and they said they saw 2,000 kids in their emergency department and 1,600 in their urgent cares just last week alone. That's like 300
crazy.
kids a day running through the emergency room, right? And so you're not wanting to sit there and wait or take your kid. But if it's late at night, you're not calling the pediatrician. You're just taking them in. That's kind of the option. But we talked to one local mom who kind of has a way around this. She is singing the praises about virtual visits. It's on an app called Cincy Kids Health Connect. You can download it and then quickly see if your child's symptoms are actually listed on there and can be seen through a virtual visit. And then you wait in your own home for a doctor or a nurse practitioner to be able to log on and see your child. Advanced practice provider Amy DeToro, she sees those patients virtually, and she kind of explained to us how this all works.
If you're kind of on the fence and you're still wondering, you can still connect with us. And if we are feeling like, okay, maybe you need to be seen in person versus doing this virtually, we will refund your visit.
That's great to know.
It is. And so it's a $48 flat fee for this visit. And then you're not like chancing it. You're not going to pay twice if you end up having to go in. One thing she says she sees a lot of that they can't do virtually is for ear infections. They have to be able to see in the ear to be able to prescribe antibiotics. So something like that's not going to work. And so then in that case, they would say, all right, we'll give you your money back. You're going to come in and see a provider. And they're able to get you in really quickly.
So is that for all antibiotics, like anything that they might actually need in antibiotics? You'd mentioned a strep test.
Yeah, so if you need a strep test or a urine test or some culture, you can go into a Children's Hospital lab that is open before those urgent cares, and you don't have to wait in line for 2 hours. You can just go get the test, go home, wait for the results, and then they'll call in whatever prescription you need. Right?
So much easier.
I know.
At least you don't have to wait. You still got a sick kid at home, but at least you don't have to wait any longer. All right, Allie, thanks so much. This is great for families.